Good day, my name is Danielle, Villaseñor from BSN2B. For this video, I'll be performing the Fundic Height Measurement, the Lupus Maneuver, and also I'll be checking the fetal heart rate using auscultation. So for the assessment, you're going to determine the needs for Lupus Maneuver. Also, you're going to assess the client's overall condition, and also you're going to determine when was the last time the client voided and when was the last time for the urine test. You're also going to have to determine their immunization history if their family has history of abnormal fetal presentation, and lastly you're going to determine their last menstrual period as well as their date of confinement. As for the planning, you're going to have to need some adequate time for you to prepare for the procedure, as well as you're going to perform this procedure during the antenatal checkup. Also, you're going to need the following equipment: stethoscope and measuring tape, draw sheet, and antibacterial hand spray. For the implementation, check the physician's order to verify the procedure. Good day, ma'am. My name is Danielle, Villaseñor. I'll be your student nurse when I'm at the University of Science and Technology. So first, may I know your name, please?
My name is Donna Ponsal.
Okay, Miss Donna. So, Miss Donna, I'll be performing the Fundal Height Measurement, the Lupus Maneuver, as well as checking the fetal heart rate. So, I'll be doing this procedure in order for us to determine and assess if your pregnancy is doing well and to check the position and the condition of your child inside the womb. So, is that okay with you?
Yes, that would be fine with me.
Okay. So, before we proceed to the procedure, would you like to go to the bathroom?
I already went earlier.
Okay, ma'am. So, provide client privacy, perform hand hygiene, and observe the proper infection control procedures. Okay, Miss Donna, so now we're going to start with the Fundic Height Measurement. This is to determine if the baby is in the right size for its gestational age. So first, ma'am, I'm going to have you in the dorsal recumbent position. Okay. Then I'm going to put a pillow on your right hip. Okay, so I'm going to pull this down and I'm going to lift your shirt up. I'm going to drape you. So if you could only please stay still during the procedure. I'm going to inspect your abdomen. Okay, if there's any problems such as scars, hernia. Okay, looks great. Now I'm going to measure your abdomen. I'm gonna measure from the top of your uterus down to the midline. Okay. Okay. So it says here in your information that you are 28 weeks pregnant and your Fundic height measurement is 28 centimeters. So that is normal because the Fundic height measurement should be the same as the number of weeks that you are pregnant. So you're good with that. Now we're going to move on with the Lupus Maneuver. Okay, Miss Donna, so you're doing great. Now we're going to move on to the Lupus Maneuver. So I'm going to help you first. You're going to relax. You can breathe in and out. I'm going to help you bend your knees. It'll help you relax more. Okay, so I'm going to explain to you. So the Lupus Maneuver is going to help us determine the position of the fetus inside your womb. Okay, so for the first maneuver, I'm going to palpate the fundal area to check if it's the baby's head or the baby's bottom in there, okay? So I'm going to wrap my hands first. For the first maneuver, stand at the client's side and face the client. Palpate the fundus using both hands. Curve your fingers around the uterus top and feel for the fetal part lying in the fundus. Okay, so now I'm going to move on to the second maneuver. We're going to locate where is the baby's back. Place your hands on either side of the client's abdomen about midway between the symphysis, pubis, and the fundus. Move the hands on the sides of the abdomen. With one hand in place to steady the uterus, the other is used to palpate the uterus opposite side with a firm circular motions. Now we're going to move on to the third maneuver. I'm going to check if the baby's head is engaged or not, okay? So
For the third maneuver, continue facing the client, grasping the lower abdomen portion immediately above the symphysis pubis between the thumb and middle finger of your hands.
Okay, now we're going to move on to the last maneuver, the fourth maneuver. We're going to check the presentation of the baby. So I'm going to move on here.
For the fourth maneuver, face the client's feet and place your hands palmar surface on each side of the client's abdomen. Use both hands to palpate the fetal head using pressing down gently with your fingertips just about 2 inches above the inguinal ligament.
Okay, you're doing great. So now we can proceed with the fetal heart rate, okay? Okay, Miss Dana, so you're doing well. I'm going to proceed with the fetal heart rate right now. So we're going to check the rhythm and the heart rate of the baby inside your womb. So is that okay with you?
Okay.
So I'm going to use this stethoscope. We're going to check with the bell side. And also I'm going to need your radial pulse, okay?
Place the bell side of the stethoscope chest piece on the fetus convex portion closest to the anterior uterine wall. Listen by pressing in firmly but very gently. Count the full minute holding stethoscope chest piece with one hand and the other for the radial pulse of the client.
Okay, so that was a full minute. I'm gonna move you to your position. We're gonna pull this down. Okay, so do you feel comfortable?
Yes, I'm good.
Okay, so I'm gonna remove this straight. Okay, Miss Dana, so thank you for your cooperation. That is all for the procedures that we're going to do with you today. So far, everything seems normal for your Fundic height as well for the fetal heart rate of your baby. And as for the position of your baby, it's in the cephalic presentation and it's not engaged yet. Okay, so everything's normal. So do you feel comfortable in your position?
Yes, I feel
Okay,
comfortable.
so would you like me to do anything else for you?
It's okay, I'm good.
Okay, so that is all. Thank you.
Thank you.
As for the documentation and evaluation, you're going to have to document the procedure that was done, the test that was performed, and the findings on the client's checklist. Also, you're going to need some supplementary notes if needed. Then you're going to notify the primary healthcare provider responsible for the client about the results, and also you're going to inform the client regarding their findings. Then you're going to perform some follow-up procedures based on the findings on the client, and you're also going to teach the client regarding the proper follow-up procedures and give some appropriate instructions based on their findings. That is all for my video. Thank you for watching.